Good afternoon, everybody. Can you hear me okay there, Fiona?
Yeah, I can, yeah.
That's fine. So I'm assuming everyone else can hear me. So welcome to this afternoon session, which is Eating Well Before, During and After. And it's presented by lovely Fiona Rolston. Fiona's a dietitian at Luke's Network, and she's based in St. Luke's Hospital in Dublin. So you're all very welcome here today for the chat. I'm not going to speak for too long because we want to make it very today. Just asking questions, function on the right. If you pop your questions into the box, and I'll ask Fiona the questions at the end of the session. And just a reminder to everybody that Fiona can't answer individual diet advice for people without a background. So you can keep the question general. So there do, and Fiona, if you want your presentation.
Okay, thank you. As Fionnuala said, my name is Fiona Rolston. I'm the Dietitian Manager at St. Luke's Radiation Oncology Network, and I'm going to be talking for the next sort of half an hour about eating well before, during and after cancer. So I suppose, as you know, there are thousands of books, blogs, websites and articles out there giving advice about what to eat to prevent cancer when you have a diagnosis of cancer and afterwards. And it can be difficult to know, I suppose, what to believe and to separate fact from fiction. So I'm hoping that in this talk, I can help clear up some of the confusion and provide some practical information for you from reliable sources and also advice from kind of the best evidence that we have. So I'm going to be kind of going through the evidence and the recommendations for diet and cancer prevention, how to eat well during cancer treatment, and tips for managing treatment side effects. I'll be talking about some common myths and misconceptions around diet and cancer, nutrition after cancer treatment, and also signposting you to some dietetic services. So I suppose the best evidence that we have in terms of cancer and prevention comes from the World Cancer Research Fund, and they published their third expert report in 2018. So the World Cancer Research Fund report is endorsed by the World Health Organization. It's a continuous update project. So that means it's an ongoing program that analyzes the hundreds and thousands of research studies that are out there on how diet, nutrition, and physical activity affects cancer risk and survival. Then the conclusions are looked at by an independent panel of experts. And from this, they came up with 8 cancer prevention recommendations that are based around healthy lifestyle choices. So I'm going to go through each of these now in turn. So the 8 points are being a healthy weight, being physically active, eating whole grains, vegetables, fruit and beans, limiting fast foods and processed foods, limiting eating little of any processed meats, limiting sugar, sweetened drinks and alcohol, and not using supplements for cancer prevention, so aiming to meet your needs through diet alone. So just starting off then with to be a healthy weight. So there is convincing scientific evidence being overweight or obese in adulthood increases the risk of 12 different cancers. So body mass index, or BMI, is commonly used as a measure of your weight in relation to your height. So you can work out by measuring your weight in kilograms and dividing it by height in meters squared. Or for an easier option, there are different kind of tables and diagrams online that you can look up to see which category you fall into. So the categories are done by kind of normal or healthy weight, BMI, which is 18.5 to 24.9, and then overweight, obese, severely obese, or morbidly obese. It also matters as well about where, if you are carrying extra weight, where you do carry it. There is evidence that there is a higher risk for people who carry a lot of weight around their abdomen or middle, so people who are kind of apple-shaped. So if you want to check that out, you can measure your waist circumference around where your belly button is. And for men, we recommend that it's less than 94 centimetres, and for women, less than 80 centimetres. So the next one is being physically active for at least, such as brisk walking for at least 30 minutes every day. And as your fitness improves, aiming for 60 minutes or more of moderate exercise, or 30 minutes or more of vigorous physical activity every day, and limiting sedentary habits such as watching television and sitting in a car driving or sitting at computers as we are now. So the next one is around eating a diet that's rich in whole grains, vegetables, fruit and beans. So for when it comes to fruit and vegetables, the recommendation is to eat at least 5 portions of fruit and vegetables every day. And the more variety, the better. So that's why we would say, you know, try and eat a rainbow, try and eat as many different colors of fruit and vegetables as you can over the day. And a portion is 1 medium-sized fruit, so a banana or apple or orange, 2 small fruits, so kiwis or mandarins, half a cup of cooked vegetables, a small bowl of salad, a bowl of homemade vegetable soup, or 3 to 4 heaped tablespoons of cooked or canned pulses, so things like chickpeas, beans, lentils. When it comes to whole grain cereals, what's important here is getting as much fibre in as you can. So the recommendation is to try and get 30 grams of fibre a day. And cereals that are have minimal processing have more fibre in them. So that's your whole grain cereals such as porridge or unsweetened muesli, whole grain breads, brown rice and pasta, and couscous and quinoa. So the next recommendation is limiting fast foods and other processed foods that are high in fat, starches and sugar. So there's a strong link between the consumption of fast foods and processed foods and being overweight and obese. So that's where the evidence for that comes from. So in terms of this, you're looking at the energy density of foods. So the energy density means the amount of energy or calories that is in 100 grams of food. So you're trying to eat as little as possible of foods that are very high energy density and trying to have more of low energy density or medium energy density foods. So a way that you can do this is to look at your food labels. So on the food label, it always says per 100 grams. So if you look at that, anything that's over 225 calories, or it might say kcal, that's considered a high energy and density food. And that tends to be things like your fast foods, cakes, biscuits, crisps, confectionery. The medium energy density ones are 125 to 225 calories per 100 grams. And that's things like bread, pasta, rice, and lean meat, poultry, and fish. And then most fruits and vegetables and pulses are low energy density of less than 125 calories per 100 grams. So the next recommendation is around limiting consumption of red meat and processed meats. So red meat is any meat that's kind of a dark red colour before cooking. So beef, pork, lamb are all considered red meats. And the recommendation from the World Cancer Research Fund isn't to go vegan and cut out all meats in your diet. They do recommend keeping your consumption of red meat to less than 500 grams or 18 ounces of cooked red meat a week. So to give you an idea of what that means, a medium steak is around 145 grams, a portion of roast meat is around 90 grams. So it just means not having red meat every day, maybe just keeping it to a couple of times a week. When it comes to processed meats, the recommendation is to really eat as little as possible of processed meats. They are meats that have been smoked, cured, or had salt or other chemical preservatives added. And there is a strong link between processed meats and some cancers, particularly colorectal or bowel cancer. So examples of processed meats are things like ham, bacon, sausages, salami, chorizo, pepperoni, and hot dogs. So the next one is around limiting consumption of sugar-sweetened drinks. So again, sugar-sweetened drinks have been linked with weight gain and being overweight or obese. And then, as I said, being overweight and obese has a strong link with 12 different cancers. So that's where this recommendation comes from. So sugary drinks are drinks that have added sugars. So if you're looking at food labels, you're looking to see whether there's added sucrose, glucose, fructose, syrup, honey, treacle, all those different terms, which basically mean types of sugar. And again, when you look at if you look per 100 grams, anything that has over 15 grams of sugar per 100 grams is considered to have a high sugar content. So again, you're looking to try and limit how much of these types of drinks you're having, and going for more of the medium or low sugar content. So when it comes to alcohol, the World Cancer Research Fund doesn't give a recommendation of how much alcohol is safe to have. They actually recommend having no alcohol at all for cancer prevention. However, if you do want to drink alcohol, what we do recommend is sticking to the general guideline recommendations. And in Ireland, that is for men to have no more than 17 standard drinks a week, and for women, no more than 11 standard drinks a week, and to try and have some alcohol-free days in the week. So a standard drink means half a pint of stout, lager, or cider, a small glass of wine, so about 100 mils, not the big globe glasses that we have nowadays. And also a standard drink is a pub measure of spirits. So then the final one from the World Cancer Research Fund is to aim to meet your nutritional needs through diet alone. So dietary supplements aren't recommended for cancer prevention. It's best to try and get all your nutrients from the foods that you eat. However, certain supplements might be prescribed by your doctor for a period of time if required. So you might be recommended to take iron supplements if your iron level is low, or vitamin D is another one that you might be recommended. The thing with dietary supplements, if you are taking or thinking about taking a dietary supplement, try to avoid very high doses. So again, look at the label and it'll tell you how much of each nutrient it has of the recommended daily allowance. So you should be trying to kind of stick to ones that meet 100%, but not way above that. So that's kind of diet and cancer prevention. So moving on then to eating well kind of during cancer treatment. So you've had a diagnosis, you're about to start treatment, or perhaps you're on treatment. What should you eat? So I suppose to start by saying there is no one size fits all. Everyone is very individual. Everyone has a very different experience during treatment. So we can't say that everyone should eat the same either. So I suppose if you're feeling well, if you haven't lost weight, or you're not losing weight unintentionally, and your appetite is good, we do recommend just kind of almost following similar to what the guidelines are for cancer prevention. So eating a balanced diet, so having lots of different coloured fruits and vegetables, your whole grains and starchy vegetables, lean meats, fish, dairy products, and keeping foods that are high in fats or refined sugars to kind of now and again, kind of in moderation. However, if you are losing weight, or unintentional weight loss, or you're really struggling with eating, this may not be suitable for you. So you really should ask your oncology team to refer you to a dietitian to get some individual advice. The goal of nutrition in cancer and during cancer treatment isn't to treat the cancer, but to maintain the person to withstand their cancer treatments. So the diet isn't going to treat your cancer. The diet is going to keep you strong and healthy so that you can tolerate your cancer treatment. And the way that we do this is by maintaining your body mass, especially your muscle, during treatment, and helping to manage symptoms or side effects of treatment. So just want to talk about weight for a moment. So during cancer treatment, such as chemotherapy or radiotherapy, the aim is always to try and keep your weight as steady as you can. Chemotherapy doses tend to be calculated around using your weight, and radiotherapy plans are often based around your body shape. So if that changes a lot during treatment, that can be a cause for concern. So the aim is trying to keep your weight steady as possible. Some treatments, such as hormone therapies or steroids, can cause weight gain during treatment. And the best thing you can do about that is trying to just eat as healthily as you can and exercise as much as you're able. Weight loss, though, is also a common side effect of cancer, and often with unintentional weight loss comes muscle loss. So often someone could be overweight or even obese to begin with, and they're losing a bit of weight, and they might be kind of happy about that. You know, they feel they've got the weight to lose, but what they can be actually losing is muscle mass, and that can kind of affect your outcomes of treatment. So we don't want that to happen. So if that's what's happening, you would be advised to follow a high protein, high energy diet. So as I said, malnutrition in cancer is a common but often under-recognized problem. The rates of malnutrition vary depending on tumor location, but rates of 8 to 84% have been reported. And I'd say unintentional weight loss can lead to loss of muscle and loss of strength. Cancer cachexia is a term you may hear, and that is a complex syndrome that's characterized by inflammation in the body, unintentional weight loss, and muscle loss. And the incidence, again, varies across different types of cancer, but tends to be more common in cancers of the digestive tract, so pancreatic, gastric, esophagus, head and neck, with lower incidence in prostate and breast cancer. The consequences of malnutrition can be a reduced quality of life, increased risk of infection, increased treatment toxicities, reduced tumor response to treatment, and reduced survival. And malnutrition in cancer can be caused by many different symptoms or side effects of treatment. So could be pain or dysphagia or swallowing difficulties due to the tumor itself. It can be due to side effects of treatment such as dry mouth, taste changes, bowel problems, nausea, poor appetite, and also can be impacted by psychological difficulties. So I'm going to go through each some of the side effects of the treatment and kind of give you some practical tips that might help with those. But firstly, just to mention the high protein, high energy diet. So again, if you're losing weight unintentionally, if you have a poor appetite or you're struggling with eating, this is what's recommended. So we recommend eating small, frequent meals and regular snacks during the day, trying to have nourishing fluids such as milky drinks, smoothies, creamy soups, and you might be recommended nutritional supplements by your dietitian or your doctor. And trying to have a protein source at each meal or snack. So that's things like your meat, chicken, fish, eggs, dairy products, nuts, beans, and pulses. So ways that you can boost your energy and protein. So if you're having breakfast cereals or desserts, you can add some nuts and seeds. You can add some yogurt and use full fat dairy products. If you're having salads, you can add avocado, nuts and seeds, oily fish, eggs, hummus. For sandwiches or toast or crackers, add a thick layer of either butter or spread, cream cheese, hummus, or nut butters. Lentils, beans, and Greek yogurt can be added into soups or casseroles. Or if you're having some mashed potato, you can add a little bit of full fat milk, some grated cheese, or extra butter or oil-based spreads. So one of the common side effects of cancer treatment can be a sore mouth. So that can be caused by chemotherapy, can cause mouth ulcers, or if you're having radiotherapy to the mouth or neck area. So some things that can help with that are keeping your mouth fresh and clean, choosing softer foods, so avoiding anything that has a very rough texture or sharp edges, such as crusty breads or crisps or kind of sometimes the crust on toast, that kind of thing. Chop, mince or mash, or even liquidize your foods. Add extra butter, milk and sauces to moisten them. Drink plenty of nourishing fluids and take care with any foods that are very spicy or acidic. Dry mouth, again, can be a side effect of radiotherapy to the mouth or neck area, but it can also be a side effect of other medications. There are a number of artificial saliva preparations that you can buy over the counter in your pharmacy. Drinking plenty of fluids, regular sips during the day and with meals can help. Again, choosing softer, moister foods. And some people find ice cubes or ice pops helpful as well. If you have swallowing difficulties, either due to obstruction from your tumour or as a side effect of treatment, let your doctor know and they can refer you to a speech and language therapist who can do a swallow assessment and recommend the suitable kind of texture diet that you need. So again, you may need to chop, mince, mash or liquidize your foods. So taste changes tends to be a common side effect of treatment as well. That can be as a side effect of medications, chemotherapy, or again, radiotherapy to the mouth or neck area. So depending which taste buds are affected will depend on what you can taste. Keep your mouth fresh and clean, so give it a good rinse out before eating. If you have a problem with a metallic taste, if everything tastes a bit kind of like metal or iron, trying to eat your food at room or cold temperatures, using plastic cutlery to eat if you're getting a strong flavour from the regular cutlery, and marinating meats in soy sauce or lemon juice can help as well. If you have a bland or no taste, so you can't taste anything, strong flavourings or seasonings can help. So you can add as much as you like of those, herbs and spices, mustard. Parmesan cheese is another one that sometimes that can come through on the taste buds. Or sour foods as well, so lemon juice, lime juice, sweet and sour sauces. Just be careful of anything that's very spicy or very citrusy or sour if your mouth is sore, because it can sting. Another one that people find useful for helping with taste changes is to suck on a piece of pineapple or pineapple chunk before meals. It just seems to help take away any bad tastes for a short period of time to help you kind of get your food in. So nausea and vomiting can be a side effect of chemotherapy, or if you're having radiotherapy to the stomach area. The advice we give for this is to eat little and often, avoiding very large meals, but also trying to avoid having an empty stomach. Sometimes if there's long gaps between eating and your stomach gets empty, that can make you feel a bit queasy, especially if you're taking medications on an empty stomach. So try dry, bland foods such as crackers, toast, plain biscuits. Some people find ginger can help, so ginger biscuits or ginger tea or ginger ale. Avoiding foods that have a very strong smell can help, so even getting a bit of fresh air before your meal times just to clear out any kind of bad smells that you have in your system. Don't lie down too soon after eating, that can sometimes make you feel a bit worse. Constipation can also make nausea worse, so if that's an issue, talk to your doctor about that. If you're vomiting, make sure you try to drink as much fluid as you can to help prevent dehydration. And if you have anti-sickness tablets, either you can take these sometimes before meals or as prescribed by your doctor or nurse. So constipation can be caused by sometimes surgery to the bowel area, can be a side effect of chemo, or sometimes pain medications or anti-sickness drugs can actually cause constipation as well. So if you have an issue with this, is trying to eat regular meals, include as much high fiber foods as you can. So that's things like your whole grain cereals and breads, raw fruit and vegetables, pulses and nuts. Fiber also absorbs fluid in your gut. So if you are increasing up your fiber, you also need to make sure you're having enough fluid as well. So aiming for 8 to 10 cups or glasses of fluid every day, and trying to add in some exercise as well can help. If the opposite is an issue for you, I suppose diarrhea can be caused when treatment irritates the lining of the digestive system, or in some cases, the tumour itself can stimulate diarrhea. If you do have diarrhea, try to eat, again, little and often. Try to avoid dehydration by drinking plenty of fluids, avoiding very greasy or spicy foods, avoiding alcohol, And sometimes avoiding foods that cause a lot of wind can help. So some fizzy drinks, chewing gum, beans, peas, onions, a lot of garlic or cabbage, sprouts, any of those foods that cause a lot of wind can sometimes worsen diarrhea. So just watch out for those. And if you have anti-diarrheal medication, just take that as prescribed by your team. So fatigue is a common side effect of treatment. So if you are fatigued and you're finding it hard to cook meals or think about shopping, do accept help from family and friends where it's offered. Make the most of the good days that you have. So if you are feeling like cooking, make some extra portions and pop them into the freezer so that they're there on the days when you really don't feel like cooking. Stock up on foods like that are tinned, so tinned soups, beans, tinned fish, and then also dairy products, so cheese and yogurts and eggs are kind of easy foods that you can reach for when you don't feel like making a big meal. Light exercise can help with fatigue, so do as much as you're able, and then avoiding caffeine or alcohol before bedtime can help you to have kind of a better night's sleep. So just to touch on exercise here, so keeping active can have a positive impact on your health and well-being and can help reduce the side effects of cancer treatments. Exercise also helps to maintain your muscle mass and also helps with strength, flexibility and mobility. So do ask your doctor before starting any new exercise, and if possible, ask to see a physiotherapist who can give you a tailored exercise plan that suits your needs. So just to mention around reducing risk of infection, chemotherapy may reduce your white blood cell count, and that can make you more susceptible to picking up infections. So if when you're having chemotherapy, you just need to be a little bit extra careful around food safety. So washing your hands, worktops, keeping chopping boards clean, check your food to make sure it's in date. Keep any raw meat or fish away from ready to eat foods. Wash your fruit and vegetables thoroughly, and store food at correct temperature, and be careful with defrosting or reheating your foods. And also just being careful of higher risk foods such as shellfish or unpasteurized cheese as well. So just to move on now to some of the sort of misconceptions that we can sometimes have around nutrition and cancer. So if you did a Google search of nutrition and cancer, you would get hundreds and thousands of different results. As I say, sometimes it's hard to know what to believe or what's fact and what's fiction. So I'm just going to go through some of the more common queries or topics that come up and just try to give you some of the evidence and advice around those. So the first and kind of common one that I get asked is, does sugar feed cancer? I suppose the answer technically is yes. Cancer cells do consume sugar or glucose, but then so do all our healthy cell in the body uses glucose to perform its functions. And there's no way of telling your body, just give this glucose to the healthy cells, don't give it to my cancer cells. And if you don't consume glucose, so if you don't have any sugar or carbohydrates, your body will actually make it from another resource. So it will break down your fat and muscle stores to make the glucose that it needs to perform its functions. So no human studies have shown that eating sugar fuels cancer growth, or that not eating carbohydrates or any sugars starve cancer either. So we don't recommend cutting out all your carbohydrates during treatment. However, as I mentioned earlier, there is an indirect link between sugar and weight gain and cancer risk. So that kind of ties in with cancer prevention. So that's where we don't recommend the very sugary drinks, which can cause weight gain. So another one that comes up is, should I avoid dairy products? Again, there's no evidence of any clear link between dairy and cancer. In fact, there is some evidence that dairy products can decrease the risk of some cancers. A lot of the theory around, or the fears around dairy products and cancer are to do with the addition of hormones to milk. But in the EU, this is strictly banned, so it's not a concern that you need to have here. Dairy products are also an excellent source of calcium. So if you are dairy as a personal choice, you will need to get your calcium from other sources. And if you are drinking plant-based milks, make sure to have a look at the label and buy one that is fortified with calcium. So another question that sometimes comes up is around soya. So soya products contain substances called phytoestrogens, and they are said to have estrogen-like properties which could theoretically drive the growth of breast tumours. However, the research is kind of showing that plant-based estrogen is chemically different to human estrogen, and in some studies, high consumption of soya foods are actually linked with lower rates of some cancers. So really, there's not enough evidence to make a firm recommendation either way around soya, but there is definitely no evidence for a need to avoid it. So then another one that often comes up is around superfoods. So a superfood is a food that is claimed to possess a strong nutritional benefit. So examples are acai berries, blueberries, chia seeds, kale, garlic, turmeric. These are often claimed to have kind of super nutrient properties. However, the claims are often based on studies of individual nutrients at very high doses in the lab setting. So it can't automatically be translated to human diets because firstly, we eat whole foods, we don't eat individual nutrients. And also, we generally don't consume these nutrients at the high levels that they are that were used in the studies. So the advice around superfoods is to focus more on having a super diet with your whole grains, your fruit and vegetables, your lean proteins, rather than focusing on superfoods or individual nutrients. So really, like, there's no harm in having any of these foods, but don't focus on them as the be all and end all. Just to say here around high dose supplements, so you may come across recommendations to take high dose capsules or supplements with some of these superfoods or nutrients in them. You do need to be careful of those, especially when you're on treatment, because they can interact with medications, they can interact with chemotherapy or radiotherapy. So if you're thinking of taking something, do talk to your doctor or your pharmacist before doing so. And I'll give you a really good resource at the end if you want to check out more around this. So then moving on then to nutrition after cancer treatment. After you have finished and recovered from your treatment, the advice to prevent cancer recurrence is the same as the advice to prevent cancer in the first instance. Their recommendation is that you follow these recommendations if you can. So you're back to being you're trying to be a healthy weight, be physically active, eat your diet that's rich in whole grains, vegetables, fruit and pulses, limiting your fast foods and processed foods, limiting consumption of red and processed meats and sugar sweetened drinks, and limiting alcohol. And again, not using supplements for cancer prevention or recurrence. However, in saying that, if you're experiencing difficulty with eating after treatment or your weight is very low after treatment, this advice may not be suitable for you. So you should seek advice from a registered dietitian. And that just leads me on to how do you access a dietitian. So there are registered dietitians working in the hospitals. So your first port of call could be to ask your doctor or your nurse specialist if you can be referred to a hospital dietitian. There are a shortage of specialist oncology dietitians in Ireland, but it definitely is worth asking your team. If you can't access a dietitian in your hospital or your day unit, you could ask your GP to refer you to a community dietitian who may be linked to your GP practice or your local health centre. Or if you wanted to go down the private route, there are dietitians who work in private practice, and their details can be accessed through the IMDI website or the Self-Employed Dietitians of Ireland website. So I just want to kind of finish by mentioning some useful links. So the World Cancer Research Fund website have really good resources around diet and cancer prevention, and also eating well during cancer. Safe Food have some really good recipes for healthy eating and also information on food safety. Breakthrough Cancer Research have a range of cookbooks on diet and cancer prevention, swallowing difficulties, cancer recovery. So that's definitely worth looking at, and you can either download the ebook or request a printed copy. The Memorial Sloan Kettering Cancer Center website in New York has a really excellent section on herbal and alternative products. So they have an A to Z of all sorts of different products, and they outline the current evidence for these products and also what the risks are, any kind of contraindications or any warnings about when not to take them. So if there is something that you were thinking about taking, it's a really good place to have a look and see what the evidence is for it or what the risks might be. For anyone, any sort of young adults with a cancer diagnosis, Trekstock in the UK have a really good resource on food and cancer. And also the Irish Cancer Society have their Diet and Cancer booklet as well. So in summary, good nutrition can help you cope with and recover from cancer treatment. During and after treatment, the advice is healthy eating unless you're otherwise advised. If you have unplanned weight loss, focus on a high protein, high energy diet, small frequent meals, and highlight any symptoms to your team, and get your nutrition advice from reliable sources. Thank you for listening.